Hi, good morning, everyone. Welcome, and thank you for tuning in to WHLI Health Talk at Nassau University Medical Center. I'm Dr. Victor Politi, and I'm the president and CEO of NuHealth, Nassau University Medical Center, that big building on Hempstead Turnpike over there in East Meadow that you guys pass on the way to work all the time. Anyway, as healthcare in America was changing, NuHealth was part of that change. And so this half-hour program will provide you with some essential information about our services, facilities, things that provide top quality care that fits into your lifestyle. NuHealth, NUMC, our roots go deep into Long Island's history. What began in 1935 as a 200-bed general hospital has now become part of a unique health organization with multiple centers of care and a commitment to deliver excellent, essential care to everyone at every stage of life. You already know us as Nassau County's premier Level 1 trauma center, but we have so much more to offer the community, including a full-service, state-of-the-art centers of care at Nassau University Medical Center, at the A. Holly Patterson Extended Care Facility, and at the Long Island Federally Qualified Healthcare Centers located throughout Long Island. So our improvements are making us a leading provider of primary and tertiary care services that rival the best in the country. So if you want to learn more about NuHealth or its centers for care, you can visit us at www.nuhealth.net. That's www.nuhealth.net. Or we have a phone number, 516-486-NUMC. That's 516-486-6862. And that's an important number, and we'll repeat it later on in the program, because if you're going to really need any services at Nassau University Medical Center, all you need to do is call that phone number. And whether you need a gastroenterologist, a cardiologist, or any type of specialist care, pediatrics, or as you'll hear today, dental medicine, you'll be able to call that one number, and we can make an appointment for you and get you in there right away to be seen by board certified, high trained doctors that are there to take care of you and that really have the right attitude and technical skills and equipment at Nassau University Medical Center. It's not the old Meadowbrook Hospital anymore. Now it's a really tertiary level trauma center. It's got burn centers. It's really state-of-the-art orthopedics, neurosurgery, just about everything. I mean, and we're really receiving a lot of awards. We just recently received an A in the Leapfrog survey. Leapfrog, it's an A for patient safety. But when they say patient safety, they don't mean that you don't get hit by a car crossing the parking lot. They mean patient safety as in infections from IV catheters or urinary tract infections or ventilator-acquired pneumonias. That's what they're looking about patient safety, and that hospital is one of the few hospitals in New York that received an A here in Nassau County. So really proud of the Leapfrog A that we received. But we've received other awards. We've received the highest standard of care, the gold standard from the American Heart Association for stroke. So we are a stroke center, someone who's suffering from any type of cerebral vascular accident, stroke, or TIA. They could come to the hospital, a stroke code is called, everybody's mobilized, and we basically are ready for you to come in with some of those clot buster medications, neurologists and neurosurgeons and neuroradiologists standing by 24/7 just for you guys. And we goes on and on. We got a gold award for heart failure, for cardiology from the American Heart Association, 5 stars for our GYN department, for GYN surgery, for vaginal deliveries, 5 stars. These things are not easy to come by, and people don't realize that Nassau University Medical Center is that quality of care on Hempstead Turnpike. Sure, we got great competition. We got great hospitals in Nassau County. We have some really great physicians and great services, but we have that. We work with all the hospitals, but you need to know that Nassau University Medical Center, in its own right, is a great hospital. And one of the programs that we're very, very proud of, and really is amazing, and is a service that you can provide to patients, is our dental program. And we just don't have a dentist at the hospital. We have a full dental residency. We have fellowships. We have oral maxillofacial fellowships. I mean, we really take dentistry to a new level. And these are really top doctors that are at the hospital every day, at the FQHCs, the Federally Qualified Health Centers that are throughout Nassau County, that are there for you. So again, that number that we mentioned before, 516-486-6862 or 516-486-NUMC. Call that number. You need a dentist, we'll hook you up. So let me just welcome our chairman of our dental department and our oral maxillofacial, Dr. Rory Sadoff. Dr. Rory Sadoff, welcome to Health Talk. Why don't you start off by telling us a little bit about yourself, where you're from, where you went to school, and where you had your training?
Okay, thank you for having me today.
Sure.
And I'm born and bred on Long Island, and you're giving in the overview of the hospital when it was called Meadowbrook. I grew up with Meadowbrook in my backyard, so I know it well. I've seen the progression. The overview you gave was very good because it's progressed to be a full scope hospital that serves many, many people. It's been a beautiful thing to see. Myself, I was raised on the mean streets of Levittown, and I did pretty well in school, and I did pretty well on the athletic fields. I had a scholarship to play lacrosse at Cornell University, and as things happened, I blew up my knee. There was no technology to address the knee injury at that time, so I just had to stop playing, but I finished my education and enjoyed it there. I then went on to dental school in New York City, a 3-year program that usually takes 4 years. And I graduated with honors, and then I was looking to specialize in some area of dentistry. And the NASA County Medical Center at the time had a residency training program, which I applied for and got into. And I did 4 years of specialty training in oral and maxillofacial surgery. My mentor, Dr. Kazi, then invited me to go into private practice with him in Rockville Center after that. And I spent a half a dozen years in Rockville Center in private practice as Dr. Kazi migrated back into the hospital to run the entire service. And as things happened, he took ill and asked me to come and help him. And I came in thinking it was a temporary situation for me. He took ill. He passed in 1990.
Sorry.
Unfortunately, yes, a wonderful man, wonderful man.
Yep.
And basically, I took over the department and became chairman and program director about 25 years ago. And I've been trying to fill Dr. Kazi's
25 years.
25 years, and I've been trying to fill Dr. Kazi's giant shoes, because he was a wonderful man. There's a plaque outside our outpatient facility, which is a bust of him.
Right,
and
I saw that.
And I go rub his nose every day for a little bit of good luck and good karma.
Yeah, I'm sure he appreciates that.
So that's, in brief, my educational background.
So dental school, and there's a lot of people listening that have children that are trying to figure out what they're doing out of high school or in college, and a lot of people are looking at medicine today, whether it's MD or DO or PAs, nurse practitioners. I mean, it's all a buzz about healthcare and healthcare changing and mid-level practitioners, podiatry, chiropractors. Dentist. What's involved in becoming a dentist?
Well, dentistry is generally an undergraduate degree, and then it's generally 4 years of training in dental school. And then there's subspecialties, like as in medicine, there's subspecialties in periodontics, prosthodontics, endodontics, root canal, things along those lines, oral maxillofacial surgery. I think there's only going to be an increasing need for people in healthcare and dentistry. I think one of the things that we see at the hospital that everybody has oral health needs. Not everybody needs to have their gallbladder taken out or have their knee fixed, but everybody's going to end up in a dentist chair or in a specialist chair for oral health somewhere in their lifetime, and it's only going to get increase the need. I think one of the things that the hospital provides is access to those that do not have access in other places. One of the missions of the hospital is to take all comers. We're trying to accommodate everybody, irrespective of the medical issues, physical issues, financial issues, and that we take great pride in that.
You do,
yeah.
So that's interesting. Dentistry as a field of medicine. So you do the 4 years of college. You have to take all the basic sciences, just like medical school.
Yes.
And you apply to dental. Is it hard to get into dental school
Yes.
as it is like medical school? It's very competitive.
It's very competitive. There's no question. The numbers of applicants is going up over time, and just in keeping with that model, in Europe, the dental individuals, they go to medical school and then they branch off into the dental field as you would for ENT or orthopedics or cardiology. So they see it as a core portion of the medical education. In this country, it's a little different. They're two parallel school systems, but we end up in the same place, and that's why we're in a hospital. I always consider our dental service the missing link between the dental community and the medical community. We do all the things that make those communities communicate with one another.
Yeah, that's great. And then you did the 4 years, and again, people are rarely interested in this, and dentistry was thriving. Then you don't hear a lot about it, but it's always there, and it's like you said, it's something that everyone needs, and there is a need for dentists in the community.
There's a need, and cost is an issue. Dentistry. And in the private sector can be quite prohibitive, the costs. So one of the things we do, we work with everybody in terms of their financial capabilities and try and deliver the care that's appropriate for them, because it is a high-end specialty, because dentistry involves laboratory work and secondary services that are expensive. So it's something that we try and provide access to those that can't gain access.
Yeah, I mean, so you have board certified dentists, specialists in different dental services, whether orthodontics or periodontics, and they're available at the hospital. And, if you have insurance, we take that insurance. If patients have Medicaid, for example, we'll work with them to make sure that that gets covered. The whole idea is to take care of everyone. Whoever needs dental work, that we're here for them.
Every case is individual. We work with them and try and come up with a plan that works for everybody. We do have 2 residency programs that are formal residency programs. They're fully accredited. They have national reputations. They do publications, and we speak at different conferences. One is in oral maxillofacial surgery, which I'm the director of. That's what I'm trained in. That's what I practice every day. And the other one is in general practice dentistry. Between the 2, we cover the inpatient side of the hospital, we cover the operating rooms, we cover the emergency room, we cover the floors, the outpatient facility. We're very active in the hospital working with patients, whether they be in the outpatient facility or they be up on the floors or the wards.
So, so the general dentistry residency, how long is that?
That's a 1-year program.
1 year after they finish the 4 years of dental school.
Yes, and it's now required in New York State to have a residency, same as the medical community, in order to get your license in New York State.
So now, oral maxillofacial surgery, that's a mouthful, but no pun intended. But it's, I mean, I know, as an ER doc, that those guys were great. And, we actually called them down to do like really microsurgery in the ER, plastic surgeries if we needed it, because they were that good at, in small spaces with small sutures to make things look beautiful. So what is OMFS? What is that?
Again, it is the expansion of the dental community into the hospital setting. So the big boost for the oral surgery community was the Korean War. Oral surgeons were doing all the maxillofacial trauma during the Korean War, and they brought back that skill set back to this country, and they started applying it in hospital setting, and they become experts in their field in management of trauma. We participate in oncology care. We work with the plastic surgery service on reconstruction. We work with the ENT service for pathology. So it's a very broad scope training. That's the reason it is a 4-year program in our institution. In half the programs in the country, it is now migrated into be a 6-year program. You gain a medical degree. So they work in coordination with the local medical schools, and they procure an oral surgery license, but as well as a medical degree. So it's expanding.
DMD is called?
DMD, DDS, and then they acquire an MD as part of their medical school training. So the scope is expanding, the areas that are covered expand, and it's impressive to watch.
You're gonna need a bigger business card. Well, those initials, right?
Yeah. Yes.
But so now, I remember, an ER trauma, any type of facial trauma we get, God forbid someone's face, it's a steering wheel, is, whatever it might be, and they have fractured mandible or maxilla, or that's what you guys came down. We called you down, and I know at NUMIC, National University Medical Center, we're a level 1 trauma center, and we got a beautiful brand new ER, $38 million. We have 2 resuscitation rooms in the ER, looks like little operating rooms. We have trauma rooms in the ER, and we have all these, board certified ER guys. So, EMS loves us. The fire departments get the car accident on the Wantor or the Meadowbrook or the Southern State, and they're coming to us. 2 heliports. The helicopters are landing like crazy with trauma victims from all over the island. And listen, the trauma call comes over. ER guys jump in, board certified guys, the trauma room is opened, the CAT scan is cleared, and then you guys come running down, because I know as soon as the trauma code level 1 goes over the PA system, the neurosurgeon comes down, the surgeons come down, the oral maxillofacial guys come down, the anesthesia comes down, and you guys are waiting to see what comes through that door when that ambulance hits. And it's sort of organized chaos. I mean, this guy hits the door, people are cutting his clothes off, putting IVs in him, and you go to the head. And so what do you guys do when you come into those trauma cases?
Well, I hold the trauma service in high regard because it is controlled chaos, and basically we respond in a timely fashion, and the patients are stabilized with ATLS protocols in terms of hemodynamic stability, and then we can come in and do a secondary survey of what things that we may be involved in: facial fractures, lacerations, neurosurgery. We work with neurosurgery if there's cranial injuries. And we assess that, and we determine if it has to go to the operating room or it can be stabilized in the ICU setting. So we work closely with all those services. As we speak right now, my team is in the OR with other attendings doing fractures that have come over the past 3 to 5 days of the midface, of the mandible, scalp laceration. So it's a very active service, and we have an excellent relationship with the ER because they don't want people waiting around, and we pride ourselves on showing up as soon as we're called. You don't have to call us twice.
Yeah. Well, and people listening don't. You could watch all the TV you want and Scrubs or whatever the show you watch there, ER, but there's nothing like when you're a doctor or you're a nurse or a PA or a dentist and you're in that hospital, and when these guys hit that door and they come into you and it's life or death, people really are at their best. You guys really, I'm so proud when I see, even as the CEO of the hospital, I'm walking all over the place. I hear level one trauma. I'm too nosy. I'm an ER doc. I stick my head in and I see you guys come down that hallway and, like the fire trucks coming to a fire and you guys are pulling hoses and knocking down the roll. I mean, it really is amazing feeling. And anyone who ever thought about being a doctor or a dentist or any of your children thinking about in high school about being a career in medicine, if you just saw this and felt the energy and excitement and the outcomes are amazing how well you guys do to these patients. I mean, they really do. You really save so many lives doing what you do. It motivates people to go into that field. I mean, I love watching you guys work.
It's very impressive as a participant, as a spectator as well, and it generates an incredible bond amongst the people that are doing it. You can work with someone for just several weeks and feel like you've known them for 20 years because you respect what they do,
Right.
You respect how they put themselves second, they put it on the line, they show up, they stay up wee hours in the morning, they forego kids' soccer games, they do what they have to do. They perform in an acute care trauma setting, and they do it again and again and again. It's impressive to be a participant as well as to be a spectator of this.
And you come in, okay, you guys stabilize them, get your CAT scans, get your X-rays. Boom, we have X-ray, we have an elevator right up to the operating room.
That's right.
And that's where the real magic happens.
Yes.
And you guys get in there with all your gowns on and and you're in there with all those little hemostats and scalpels and you go to work. And it really is it's like an artistry. It's like watching you guys get in there and really work on the face, work on the oral maxillofacial trauma that you see. It's really amazing how the outcomes are.
With regard to the trauma, it'd be preferable not to rush to the OR, but the situation dictates what goes on. You'd like to be able to make a treatment plan with not being under pressure. But if you do have to go to the OR, you know that you may have to go back for several visits. It may be staged procedures. You accomplish phase one in the acute care setting, and then you can discuss with the families and make decisions about rationale, options, benefits, and fully inform the family. So when we have a relationship with the trauma patients, it's not a one and done by any means.
Yeah. And then right after the ORs, which is state-of-the-art operating rooms, you go brand new surgical intensive care unit. So just recently, a couple of weeks ago, we opened up, cut the ribbon on a brand new intensive care unit, a brand new surgical intensive care unit, a brand new coronary care unit. So these are brand new. So it's your hard work in the operating room then transfers over to the intensive care units. Now we follow that patient. We have specialist intensivists that are there. As a matter of fact, this July we're opening up 2 new fellowships. A cardiology fellowship and a pulmonary critical care fellowship. So that's going to be another layer of attending level physicians 24 hours a day in those intensive care units to watch your patients after you did the magic that you did in the operating room. Now we continue it in the intensive care unit and then up to a brand new floor, either the 11th floor or the 9th floor, for the remainder of their hospitalization. And again, we're talking to a dentist, we're talking to an oral maxillofacial surgery, and we just went through the operating room to the intensive care unit to our patient med surge floors. And so we're sort of talking about the extreme of what you do, but the everyday stuff, the everyday dental stuff that goes on downstairs. I mean, that also is state of the art. It's really amazing. So why don't you tell us about what happens downstairs?
I will. I just wanted to mention about the facility upgrades that you mentioned. It gives everybody a lot more pride in what they do. It makes them take pride that the facility is modern and up to date, and it really rejuvenates people's efforts with regard to the acute care setting. So that is duly noted and duly appreciated, the changes that have been taking place in the hospital. Downstairs is really where the bulk of our activity takes place. So we have 2 physical facilities in the hospital. We have a general dental clinic, which is more elective and semi-urgent care, and we have our oral and maxillofacial surgery clinic. It is a mouthful, and we basically deliver more acute care. We're in direct communication with the emergency room, and we see patients directly out of the emergency room, whether it be a child falling off a bike, a nursing home patient that's having some problems where no one else will see them, the myriad of issues, someone that's swollen, acute pain, the list goes on and on. So we address those things in an acute fashion. If anyone has ever had dental pain, they know it's relentless. You can't run from it. It's in your head, and you need to be treated in a timely fashion. We do that every day. Some patients we are able to provide anesthetic for, general anesthesia for, but I think in modern day approaches, we train our residents with local anesthetic, laughing gas, nitrous oxide, pain management issues. It should not be a traumatic experience having an outpatient procedure done. in our service. And if people sometimes just have phobias, which we understand, we can reschedule them for general anesthesia if they meet the criteria if they're not high risk.
So, someone comes to the ER with tooth pain, right?
Yes.
So why would you go to the ER with tooth pain? Well, heck, that's a 10 over 10 pain in my face and it hurts. So I'm going to the emergency room. So now they show up at Nassau University Medical Center. We triage them. The ER doc takes a look at you, opens your mouth, and says, what seems to be wrong? Tooth hurts, right? And you guys, if we send them down to you, or do you guys come up to the ER?
They will come down to us. We can use take our radiographs and our lighting and use our facility to examine and triage and make a determination what's going on. But the reason they end up in the ER is either because their practitioner on the outside is not available at 10 o'clock at night, or basically funding is an issue for them. They don't have a primary care dentist, or they haven't tapped into the community health centers that we have, the FQHCs, which are a beautiful place to access for people in the community. So they end up in our facility in acute distress. We will assess, can that tooth be salvaged, or the source of the issue can be salvaged? Do they need drainage of the situation? Do they need to be admitted to the hospital? Is it so serious that there may be airway issues or pain that's unrelenting? So we make those decisions. The majority can be managed in our outpatient facility with local anesthetic, reinforcement, consoling people, let them know that we're on their side, we're in this together, and people will trust us. Gaining trust is a big part of it, and we walk them through this traumatic experience, which can be traumatic. And I can't tell you how many times people have thanked us profusely, and I have to. People generally have some bloody gauze in their mouth, so I have an arm's length so that I don't get hugged with bloody gauze. But people are, for the most part, very appreciative of the things we do. We generally resolve things on the same day in our outpatient setting with extractions, or we send them to our other clinic for root canal or restorations where they can salvage if a tooth, if it's an aesthetic area and they're concerned about losing it, we have that option to salvage it with the common modern dentistry.
We receive a lot of positive feedback, patient satisfaction scores, letters from patients. I receive a lot of thank yous that I forward over to you guys, for the work that you do for the patients, because they are very satisfied. And again, you come in, you have a cavity. Let's go routine. You go down to see you, something's hurting, it's pain, they have a cavity in their mouth. You guys will x-ray it.
Yes.
You'll drill it and fill it and
Yes.
and treat them and treat them.
So oral surgery does the triage. If it's not something that needs a surgical intervention, we refer them over to our other clinic. They will get the restoration and treatment.
Could that happen all at the same time? I mean,
well,
how
the
does
facilities are separately located. So the oral surgery, which because the majority of the patients are acute, coming from the ER, we triage them first to save the patient time of running through the system.
Right.
Most of them will resolve there, but if it's something, as you just mentioned, that someone wants to salvage, we'll send them to our dental clinic, and they can have a discussion about what's involved in salvaging it and get treated that day and be done.
Because if I have a cavity, heck, I'm going to the hospital or I'm going to my dentist, I want the thing fixed. I want
Yes.
them to drill it and do what they have to do. We're capable of doing that.
Absolutely.
You guys can
Absolutely.
do that.
Absolutely.
So they,
Yes.
someone has a cavity, come on in.
What happens is, yes, they'll have a cavity, but generally there's an underlying issue with dental hygiene, perhaps, or other areas that are basically time bombs that there's going to be a problem in the weeks or months to come. So we try and give a person a comprehensive overview of what's involved. We will address the specific issue that day to take them out of acute distress,
Right.
but we give them a bigger overview of what's involved and what their needs are going to be during the next 6 to 12 months.
So you make an appointment at the primary care dental clinic.
Yes. Yes.
And then they'll do a real, they'll go through every tooth with a little prick thing. And
Full
say,
mouth
okay,
series of
full
x-rays.
mouth x-rays.
Yes.
And sort of give you the whole picture like you would do it at your dentist office.
Comprehensive dental care.
So can we be at NuMIC, the primary dental clinic? Can we be the primary dentist? Say for myself, I don't have a dentist.
Yes.
I want a dentist. I can call this number, and you can then arrange for me to have a dentist.
Yes.
A dentist.
Yes, we can. The only limitation I have is the number of operatories and residents we have. We currently have 5 residents. It's the volume that we can get through in that period of time. We go nonstop, and yes, that's the only limiting factor. If we had 10 residents or 20 residents, I'm not plugging for that. I'm just saying that is the limiting step in terms of public access for the elected.
But right now, as far as patients coming in for appointments, we have open slots, and you can still fill it?
We call when we schedule according to, yes, we have slots. It may not be that day or that week, but we'll have slots and we'll schedule. Yes.
Good,
Yes.
because that's what we want to do. Now, we also mentioned the federally qualified health centers, our family health centers, and there's 5 of them out there right now in Long Island and Westbury, and we have one in Elmont, in Hempstead, in Freeport, and in what's the 5th one?
South Ocean.
South, yeah, right. So those 5 are out there, and you have dentists in those 5 clinics?
So we have them in 3 of them at this point in time. We have them in Freeport Roosevelt, we have them in Elmont, and we have them in Westbury.
In Westbury. And
Yes.
same phone number to get
No,
through that?
those are separate telephone numbers, which I apologize, I don't have them with you right now.
Well, you can give the hospitalists.
Yes.
We'll arrange it for them
Yes.
if they call that the NUMC number.
Absolutely.
Sure.
Yes.
And then if they live in those areas, they don't have to come to the hospital on Hempstead Turnpike. They can go to one of those family health centers.
Yes.
Which by the way, are full family health centers.
Yes.
They have internists, they have family practice doctors, they have nurse practitioners. You can go there for your routine care. You can go there for your diabetes, your hypertension, or whatever your chronic ailments are. They're excellent at those types of services. These are, you hear a lot about these urgent cares and doc in the boxes, and what those things are Band-Aids. You go in there and you see them, and you have an earache, they give you a prescription, and you go out, and that's, and they serve a purpose, and there's nothing wrong with that. But the family health centers are the old-fashioned doctor offices. That's where you go in and you see Dr. Politi, and he's your private doctor, and he gets all your blood tests and follows up with you, and as you come back, and monitors your blood pressure and your sugar and your A1C and stuff. So that's what that family health clinic center is. And so what you're doing now, which is really amazing, and has full support from the hospital, is you're putting dentists out there. So, my thought was if you were able to take care of yourself to the point where now you're doing your dental care and your teeth are shiny white, heck, you're in good shape. You're going to make it into your 50s, 60s, 70s because you're taking care of yourself. And I think dental care is an indicator, an overall indicator of your total health. So someone who's taking care of their teeth, they're taking care of their heart and their lungs and their brain, and so it's so important that you put them out into these communities, and we really appreciate that extra effort.
I couldn't have said that better, because oral health is an indicator of overall health, and most things, like everything else, are prophylactic. You try and take care of your body before a problem arises. With regard to the FQHCs, with regard to medicine, obstetrics, dentistry, they are primary care centers. They do a myriad of services, but they use the hospital, as they would for the other services, as a safety net. If there's tertiary care or more complex cases that need to be managed, that's why we're there. We are a safety net for the FQHCs. They can send stuff over to us, as you would in medicine, as you would in obstetrics, and they provide a wealth of treatment out in the community. But I think one of the important things you touched upon is basically oral health, going to see the dentist, doing things prophylactically so you don't have a problem when you come in. It'll with respect to diabetes, coronary care, just your immune system. If you have good dental health, it just translates to good overall health.
So that's great segue. Dental health, right? What should we do to maintain our dental health? I mean, just because I paint my teeth with white out and they're nice and shiny doesn't mean they're healthy. What can we do? What can we tell people about their teeth?
Well, I think it starts when kids are young. I think they say at about a year old, you should come in and have your first dental appointment, so the child is not. They get acclimated to the dental environment, even if they have baby teeth in terms of the parents keeping them clean, in terms of hygiene, in terms of things to expect, to instruct the parents not to have the child sleep with juice at night, because that's a big source of what we see.
The bottle.
It's called bottle carrier syndrome. Kids sleep because they cry, and it's easy to appease them with some juice. And they come into us at age 2, 3, and 4 with decayed out baby teeth. It's very sad to see. They wake up with an abscess, and we have to manage a 3 or 4-year-old in an outpatient setting who's frightened and afraid, but must be managed because they're infected. So we give education in the early phase. We talk about orthodontic intervention when kids basically go ahead and need at a young age before all the permanent teeth in, so they can evaluate that. And as adults, the landmarks are flossing twice a day, which no one will do. But even if you just rinse out after you eat, if you basically just go ahead and have a meal, as we had a bagel this morning, just rinse out afterwards, and you won't have all that stuff lying
Drink a lot of water.
Drink a lot for general health in general.
My 2 kids, both of them when they were younger, my wife had their teeth sealed, and they never had a cavity. I mean, my son is 27 years old, and he never had a cavity. I mean, I was in the dentist when I grew up. My parents had me in the dentist every other week, getting drilled, nitrous oxide. They were drilling. I have more metal in my mouth than I can go through an airport.
I got you on that one. I'm way ahead of you on that one.
Yeah, but that sealing really works.
Well, I'm glad you brought that up, because that's another thing. When their first molars start to show up around 6 or 7, kids don't take care of their teeth. Basically, they're nooks and crannies. They put the plastic sealant over it, and it's like your grandma's plastic furniture cover in the old house. And keeps the teeth pristine and virginal for their entire life.
It really is
Yeah.
amazing. And
Yeah.
so, I mean, so I guess you guys are totally against that stuff then. There goes the visits. But it's a great thing. And I mean, it really is amazing where dentistry is going. And so, brush your teeth at least every morning and every night if you could, get away with it, at least once a day.
For cleanliness and for how odor. Brush your tongue.
Don't eat any onions and garlic for the odor.
I'm at fault on that one.
Yeah,
Yes.
yeah, and brush your tongue, right?
Yes.
People forget to brush their tongue, right?
Yes.
Get that stuff off. But it's really amazing where dentistry is going, and the fact that you can do all these things and basically pain free. You have the medication and the analgesics to make sure that people have a good experience at the dentist, and I think that's what we're about at NuHealth. That's what we're about at Nassau University Medical Center, taking care of patients of all walks of life. Doesn't matter, where they're from or what they're doing. We're here for them for every service that you could possibly imagine. With the top doctors, look at you, Dr. Rory. You're a top doctor. I mean, really are.
You're making me blush.
No, but it's the truth. And you're here at Nassau University Medical Center. People don't realize the quality of doctors that I have here and I put onto this show. So I want to thank everyone today for listening. I could talk, Dr. Sadoff. I had I'm going to ask you a bunch of questions after the show about teeth. Anyway, so thank you all for listening today. I really appreciate you being here. I hope it's early in the morning on Saturday, so I hope you guys are brushing your teeth this morning and do a good job. And floss if you can. Well, I always had a hard time with that, but flossing and my big fat fingers in my mouth. And then just take care of yourself. We're here for you on the Hempstead Turnpike. Again, I'm Dr. Victor Politi from Nassau University Medical Center, wishing you the best day ever. Thank you.
Thank you for having me.